Welcome everybody, Speaker Series. We're with Dr. Janelle Murphy from Calgary Integrative Medicine.
Hey.
So, we're going to talk about optimal foods for fertility and optimal foods for everyone's health on a daily basis. So welcome.
Thank you.
Okay, Dr. Murphy, first of all, what kind of medicine do you practice?
So I'm a naturopathic doctor. So we are naturopathic physicians. They kind of treat the whole. We look at kind of all causes for a certain illness or just to be a healthier person in general. We have all sorts of modalities to do such.
Okay, awesome. So we're going to jump right into our first question. How do you view health as it pertains to fertility from your perspective?
So what I like to look at is, people that are trying to get pregnant or focusing on fertility, they're really taking that opportunity to make sure they're in the best health of their lives. And that's fantastic, and I love that, but everybody should view it like that. We should all be preparing as if we're having a pregnancy, right? We should all be putting our bodies first and making sure that we have proper foods to balance our hormones and to balance out ourselves.
So can you tell us more about these perspectives, or what are some foods that we should probably try to eat more? Because I probably could use some of that advice as well too.
So another thing too is when I look at fertility, I like to look at kind of preconception, conception, and most importantly post-conception. So when you've got your little one in your hands, you want to make sure that you're in the best health of your life so that you can be there for your child. And so one of the things I like to look at is sort of a broad overview of what can you do to kind of treat multiple things at the same time. And one of those things that I like to look at is actually the insulin response. The insulin response is quite dramatic in the body. Insulin can kind of act as that little light switch. So as soon as the high insulin levels are in the body, it can trigger hormone imbalance. It can trigger things like shifts to the neurotransmitters. It can trigger weight gain, and most importantly, infertility. Okay,
so there are something called low glycemic food. Is that kind of related to that? I don't have a background on this. So what's a low glycemic food? Should we want to eat those things?
Yeah, so what I usually suggest for 99% of patients is a low glycemic index.
Okay, low glycemic index. Let me write that down. Right?
Take notes.
So what does that mean? Like if it was in simple English for me.
Okay. So let's say you went out to 7-Eleven and you got your favorite candy bar, which is what?
O. Henry.
O. Henry. So you're going to eat an O. Henry, you're going to put it in your mouth, and your body's going to say, yay, sugar, and it's going to spike the insulin response, okay? Insulin's a hormone that's secreted by the pancreas. As soon as insulin goes off in the body, it starts the flashing. Here comes the inflammation, here comes the sugar high and then the crash, here comes the, in time, if you had an O. Henry bar every single day, here comes the disruption to the endocrine system, rises to testosterone, changes to estrogen, changes to progesterone, changes to hormones called LH and FSH that are responsible for ovulation, and basically a whole cascade of a disaster.
Okay.
Does it mean you can't have that O. Henry bar? No. Does it mean you have to balance it? Yes.
Give a thumbs down for that and get that O. Henry. Okay.
So what I encourage patients to do is something like an 80-20 or 90-10 balance. So let's say 90.
Okay.
90% of the time you're going to have foods that are low in sugar, low in the glycemic index. So healthy fats, healthy proteins, lots of vegetables, fruits that are lower in sugar, avoiding things like bananas and pineapples and mangoes, focusing on berries and things that are antioxidant rich.
So when I am walking in 7-Eleven as a single man like myself, or even a pregnant woman, pregnant surrogate, what should I be getting at the 7-Eleven then?
The first thing you should be doing at 7-Eleven is walking out.
There's beef jerky, I'm thinking. There's a Slurpee.
So let's shift 7-Eleven actually to a grocery store. So when you walk into a grocery store, I try to encourage my patients to not even look at the inside of it. So sticking to the outside of the grocery store. Where are your vegetables? Where are the proteins? Where are things that if you were in the Paleolithic times, you could walk around and you could just grab? So a cow and making a steak, or some vegetables and making a nice salad, things like that are generally not going to spike the insulin response. As soon as we have pastas, pizzas, all kinds of grains, including gluten-free grains too, because they can wreak havoc on our endocrine system as well, those things are going to spike that insulin response.
Okay, Cool. I won't be going to 7-Eleven. You've convinced me of that. Okay, so we are touching on something about avoiding. You told us about avoiding. You know, how about eating, like, I mean, I've heard all these things saying eat like 10 meals a day, 6 meals a day. I avoid breakfast because I'm very busy. I get up, I wake up with my phone in front of my face. Like, you know, how many meals a day should we have?
So I actually encourage patients to have 3 meals a day. And I do encourage patients to have a 5-hour gap between each meal. This is a big principle based on a diet that we're strong believers at Calgary Integrative Medicine, and that's metabolic balance. Metabolic balance is an anti-inflammatory as well as a low glycemic index diet and weight loss diet out of Germany. Using the premise of that diet, it's 3 meals a day. So you're spiking your insulin levels, not as much as, let's say, a Henry bar, because you're having low glycemic foods. You're allowing your body to fully recover the insulin response before your next meal. And then you're recovering and then eating. If you have 5 meals a day, which a lot of people do, and a lot of people it works great for, and one thing I like to promote is that not one diet fits all, but for the most part, it does. If you're having 5 meals a day, little spike of insulin, we don't have a chance to respond. Little spike of insulin, no response. Little spike, and then you kind of reach that insulin threshold where you start to develop issues with insulin resistance, and that's where we start to run into problems. So 3 meals a day is key. Having those meals having a low glycemic index, low sugar, not a lot of carbs, not eating after 9 p.m., and making sure that there's not a lot of snacks, and that includes things like coffee and tea. As soon as you have those between the meals too, you're still spiking that insulin response.
Okay, so we're talking about trying not to spike that insulin response, but it's very inevitable for, I'm just thinking of our demographic, pregnant ladies, they have cravings. So what is your advice for us? I speak like as if I'm a pregnant woman. So what's your advice for pregnant preggers who have cravings? Like, you know, it's just, there's also binge nights too, right? So.
Of course, yeah. And that's healthy and normal. It's just a matter of making sure it doesn't get out of hand and making sure that you're not just putting pure sugar into you and into your baby. And even if you're not a woman trying to get pregnant, somebody just like a man, for example, who just wants to be healthy for themselves, and if you're going to have a child, making sure that they can be the best father or mother that they can be. So, you know, having healthy nuts and seeds and things like that to kind of
nuts, seeds. Nuts and seeds. We have a few viewers. Nuts and seeds. Hope you just joined us. Okay.
So, and healthy nuts too, almonds, pumpkin seeds, sunflower seeds, trying to stay away from peanuts and things like that can have toxins in them. A lot of women have sugar cravings, so, you know, maybe try having an apple or an applesauce with some cinnamon and having that with your meal. I like to suggest that people have their meal followed by a nice thing like applesauce and cinnamon, just to combat that craving a little bit.
Applesauce and cinnamon. Okay.
That's my personal favorite.
Good, thank you. That's a great tip. So that is for the cravings question. We had we have a few scenarios. So it's this person that wrote in was, we are a gay couple creating a baby, and do you have any tips for us to create the best sample before they donate or put their sample?
Yeah, of course. So again, as we're talking about insulin, because as I briefly mentioned before, as soon as the insulin spike comes, it'll start to wreak havoc on the endocrine system. So it can really start to affect the testosterone levels, which are very crucial for sperm production and motility, as well as things like LH and FSH. So again, we can always bring this back to food, and we can bring it back to having that low.
You are what you eat, right? So
absolutely, you are what you eat.
So would you say that like for anybody, what is your final tip that you want to give everybody besides just eat healthy, eat lots of applesauce, nuts, no peanuts? What's your final words for all of us?
My final words are, I'm a huge advocate of moderation. So, you know, if you're going to go out and have a pizza, that's fine. Eat the pizza, enjoy the pizza, but don't have pizza for another week or so. Make sure that that's, again, that 10% or 90%, 90-10 split. The rest of the time, make sure you're having a healthy meal. Make sure that you're treating your body well. Have the fruits, have the vegetables, have the protein. If you can have proteins that are low hormone, low antibiotic, fantastic, even better. I just, want to make sure that people just take the time to take care of themselves. if they're a little bit overweight, or if their hormones are out of whack, or you're starting to see issues with skin and acne, and little signals that maybe even your mood is off, or you're starting to get depression or anxiety, little signals that might indicate that your hormones are imbalanced. That this is a key thing to look at, especially people that don't necessarily have the time or money or resources to go and get a full hormone panel to see what's going on. Just try with a diet. Try working the insulin levels. It can do 90% of the work in a lot of different people. Making sure that you feel energized and your body doesn't suffer from things like depression or anxiety, that you have proper cycles, that you're not carrying extra weight around that inhibits some of these things. And then the very key thing that I'd like to talk about is insulin. I've been talking about that the whole time, is inflammation. So inflammation, everybody has got some form of inflammation, and mitigating that insulin response is a good way of decreasing that. So low inflammation, proper sperm motility, fertility, and then just being the best that you can be to take care of your little ones.
Oh, okay. Awesome. I think I see a question there. Something about fertility foods are not the same thing as aphrodisiac foods, right?
No.
Do you have anything to say about that?
Yeah, so I mean, some of the aphrodisiac foods, things like chocolate and oysters and all these types of things, great foods, look at them and say, yeah, it's an aphrodisiac food, but really, what's the purpose of the aphrodisiac? Is it because you've got low libido? Is it because you're too tired? What's going on that you need an aphrodisiac food, right? So look at those causes. Look at, okay, maybe something is going on with my fatigue. When I eat something like a bowl of pasta, maybe I feel awful and my energy plummets. That's probably not the best food to put in your body. So if you're eating something light and fresh, that can be just as much an aphrodisiac as something like an oyster.
Okay. I will avoid the oysters and oh Henry. Okay, there you have it. We have Dr. Janelle Murphy from Calgary Integrative Medicine. Thank you so much for joining us on Proud Fertility, Surrogacy and Egg Donation Canada Facebook Live Speaker Series.
Thank you.
Thank you.